It's 2:30 on a Friday. That means it's all things advocacy with AARP North Dakota. Josh Askvig, State Director of AARP North Dakota, with me as always, Janelle Most. Janelle, we're back twice in 1 week.
Yeah, twice in 1 week. Yes.
And we've got a little bit different setup today. So if we start sweating, it's because we got a little bit better lighting after some of us couldn't find it right in front of our faces. But inside joke for those of us in the office. But before we get into this, first of all, for those of you who attended the Legislative Lowdown, thank you again for doing that on Monday. I had a blast. I think you had a blast. Our teams that were out in the various sites said they had a blast as well. But we have officially turned the calendar page into what is my favorite sports month, which is March. And that's because it is March Madness basketball season is part of it. Are you excited that it's March or no? You don't care. You're ready for softball season.
Yes, softball season, but it does start in March, so too. But we just got another 12 feet of snow on Wednesday, which actually
felt like 12 feet of snow. It was 12 inches.
12 inches of snow, but it actually delayed the start of the legislature, which I don't know if that's ever happened. But
according to some Twitter traffic, I think it's happened before, but and it didn't delay it all the way.
No, just a half a day.
Just half a day.
Yeah.
Half a day as part of it. I had never seen that either, but apparently it had indeed happened. So, well. This is the mailbag episode, and so we're going to get to some of the questions left over from the Legislative Lowdowns on Monday that you all asked and others asked at this site. And we may do this more often as well. But before we do that, there was action this week. The legislature returned to town. They were supposed to start on Wednesday. You just alluded to this, but instead didn't get started till Wednesday afternoon. They actually had a floor session this afternoon. I heard you listening to it before we got started. We did have an issue we engaged on this week, so you want to give folks a little bit of an update on that.
Yeah, if you remember, the paid family leave bill was considered in the first half of the session. Unfortunately, it didn't receive a favorable recommendation and ended up not passing in the House, but a Senate concurrent resolution was introduced right before crossover, which means it's still alive in a different form, but it's still alive. And so we spoke, in favor of the Senate concurrent resolution yesterday, which would encourage legislative management to adopt a study to really dig in more deeply about paid family leave. And the reason we care about it is caregivers. People think, we are solely focused on prescription drugs, right? But no, we also support those 68,000, unpaid family caregivers, and paid family leave will be one way that could really help folks continue to care for loved ones in their homes and keeps them out of nursing homes.
And we're not the only state that's talking about this right now, correct?
No, there are a lot of states that are really considering state paid family leave programs. There's the federal family leave program, but this would allow states to have a little bit more control and figure out what's going to work for this state in particular. And that's why this study was introduced, to really dig in and see, what are the pros and cons of having a state-run paid family leave program. And again, most of our caregivers we know are either still working, either part-time or full-time, and often they have to take leave, maybe even extended leave. And so it leaves both the employer in a lurch, and it also leaves them trying to balance, how do I care for a loved one, but how do I, make sure that I'm honoring my work obligations. So paid family leave is really a win-win potentially for both caregivers as well as employers.
Yeah, absolutely. So did the committee take any action on this?
They didn't. They kind of hit pause yesterday afternoon, and they did take it up again this morning, just because one of the senators was not there yesterday, but they didn't take any official action yet.
Gotcha. So some will be watching on that. In addition, I think they started some of the budget overviews for the second half of the session. So as a reminder, in case you weren't there on Monday, or you haven't had a chance to watch the recording of the Legislative Lowdown, we're at the point in the session where all of the bills that were introduced and passed on the Senate side have gone over to the House and vice versa. And so now all of those budgets that were considered by one chamber are now on the opposite side. So did we learn anything so far on the budget overviews that we were watching this week?
The one in particular we were following this week was the Industrial Commission budget. And in there, we dig real deep into the North Dakota Housing Finance Agency. And in that budget is the Housing Incentive Fund. Yeah. And so the governor in his budget included $25 million for the Housing Incentive Fund. And again, this helps build low-income housing, make sure that, folks can find alternative ways of not having to, move out of their communities. That was going to be paid for out of the Legacy Fund. When the House considered this budget, they cut it down to $12.5 million, and they're saying they'd like to see that be paid out of the general fund. So this is now where the Senate gets to learn what the House did, what the governor proposed, and then they get to put their own stamp on it and figure out where does HIF sit in the entire budget process and what do they want to invest in low-income housing.
And I know we'll be pushing to try and get it back to restore to at least the 25 million. And I actually think the 25 million is a drop in the bucket based on what we've seen in the housing needs assessment report done by Housing and Finance as part of it. So
it really is. And they go through the money. I mean, it's gone within,
weeks.
A matter of weeks.
Right.
The money goes super quickly. The other budget we were watching is the Department of Human Services. They just provided a real high level overview of the agency, and also, they compared what the governor had put in their budget and then what the House or what the Senate had made some decisions on. So now again, the House gets to compare those numbers and then figure out where their priorities are.
Absolutely. So with that, let's just talk next week. Next week is kind of everything. Everything we're watching. I think you and I were talking a little bit about this. We're going to sit down after this and kind of lay out next week. But based on what you were sharing with me before we went live here, essentially all 4 of our priorities in some way, shape, or form are going to be showing up in committee next week.
Yeah, that's true. So pensions is up. Both pension bills will be considered late in the week on Thursday, just 45 minutes apart. So this is where you get to learn that I keep backup shoes in my purse. So I wear heels in committee hearings, but I stick flats in my purse so I can run from one side of the Capitol to the other in a short amount of time. But both pension bills are up. The one that Senator Cleary and Senator Dever, the 2239, that's going to be in the House, and then 1040, which is, the leader to look for and the retirement committee push forward. So we'll get to have a conversation about pensions all in one day. And again, we want to make sure that retirement security stays sound for folks.
Yeah. In addition to that, another big priority for us, prescription drug relief and the insulin cap bill, which we are supportive of, 2140. Is still alive, and that's up next week as well.
Yep, that's up in the House Human Services Committee. And if you remember, it was amended and it now includes, cap at $25 both for the insulin and supplies, which is different than what we see at the federal level, but still, folks could see relief on both ends of the spectrum, both within the state, if they're, under the state employee plan, as well as at the federal level. So big steps forward in prescription drugs.
Yeah, absolutely. And then the third priority area around helping prevent fraud and scams, the financial crimes victim restitution bill is also up next week.
Yes. So they will hear from us again, and we'll talk about really the importance of, providing some level of relief for financial fraud victims.
Yeah, and I think this is a good time to just tell folks watching and those paying attention that this is the part of the session where things really start moving really fast. And so if you're not signed up for our emails, go back and watch the Legislative Lowdown. There's some information on how you can sign up for our emails there, or check out aarp.org/ND Advocacy to figure out how you can sign up to get our emails, because it's likely we'll be sending emails fairly regularly asking you to take action on these issues of importance or reach out to your legislators as part of it. Anything else next week you want to touch on?
No. Mm-mm.
All right. Well, then let's jump into what we promised folks we would do during the Legislative Lowdown, which is do a mailbag episode. And we have, and I first want to put this caveat on this, first of all, which is we got a number of questions from y'all. They're excellent questions. Very appreciative of all of the questions you asked. Janelle and I and the rest of the team are still skimming through all of them, making sure we get answers for you, getting resources for you where we can, and do all that. Our goal is to have them posted on the ND Advocacy page, so aarp.org/ND Advocacy page by next week, sometime probably midweek. So stay tuned. If we didn't get to your question last week or on Monday, and we don't get to your question today, we have your question. I promise you we have your question. There's a lot of really good questions, and we're sifting through them and getting answers to them that will get posted on the website next week. And maybe, Marnie, you can make a note for us that next week we can show folks where on the actual advocacy page we'll have those posted as far as. And she just gave me a thumbs up from behind the camera. So as part of it. So awesome. With that, let's jump into the mailbag. And Marnie already has the first question loaded. And that is, we were just talking about this bill, Senate Bill 2140, the insulin cap. This was asked during the live part of the Legislative Lowdown, but I think it's worth revisiting given it's a priority of ours and I think an issue of concern. And that is, does the insulin cap include public employee retirees?
Yes, it does. And I think, again, that's a big step forward. Again, it'll cap insulin costs at $25 and the supplies. Again, I think legislators are going to need to hear from folks on this issue and why so many people can't afford insulin. Granted, this doesn't cover private insurers, but it does cover, public employees. And I think we need to make sure that we can help push this one, forward for full consideration in the House. So.
The thing I just want to clarify is it would cover public employees as long as they're on the Public Employees Retirement System health plan as part of it. Additionally, and this will be in the question and answer document that we post next week as part of it. And I know because I helped draft the response to some of this is for those of you who are not a public employee and don't have insurance through the Public Employees Retirement System program, but you do have prescription drug coverage through your Medicare Part D plan, is as long as your Medicare Part D plan covers insulin and insulin supplies, there is now a $35 cap under Medicare, under the new federal law that was passed last year that AARP backed for those of you that have Medicare Part D and have coverage of insulin under that as well. So maybe I just muddied it, but just short answer is if you're a public employee that's retired and still drawing your health insurance from the Public Employees Retirement System health plan, you will have coverage should 2140 pass the House and get signed into law. Really important that if you haven't had, I'll just put the caveat out there, start talking to your members of the House of Representatives. This will be a big climb on the second half to get this done. So anything else on that issue?
No. Mm-hmm.
All right, then let's talk about our second question for the mailbag. This is an issue we spent a little bit of time on the Legislative Lowdown talking about homestead property tax credit and about relief for homeowners from property taxes. Question came in from one of our watchers and viewers. My rent keeps going up every year. Are there any rent incentives to help me?
I really like this question because we often talk about folks being able to stay in their homes, but we often don't talk a lot about, there's a lot of folks that rent. And so what's great about the homestead property tax credit is renters can also apply for it. And again, there are income restrictions, but it caps at $42,000. But if you're really struggling to pay for your rent, you can go and you can apply for that tax credit, and it will again help not only homeowners, but we can also look at those folks that rent places as well. So.
Yeah, absolutely. And you can find that reference at tax.nd.gov/homestead. That will get you the North Dakota Homestead Property Tax Credit Program and the Renter's Refund is part of that same program. They're the same program under it as well, and encourage you to take advantage of that. The other thing we should touch on, this is unplanned, but I think make sure is, and we're going to share another resource to another question here in a little bit, but I also think if you are struggling to pay rent or have housing needs assistance, you can always reach out to the AARP, to the North Dakota Aging and Disability Resource Link. That's a program that's set up through the state of North Dakota that helps folks, older adults, try and access resources. Stay tuned. We're going to post that as a response to another question as well. You can also go there for that as well. So yes, there are programs that help folks with renters. Great question. Thank you for those of you who asked it. Very, very happy with that. So third one that we're going to get to today, and I think this is I so appreciate this question. We're hearing more and more about romance scams right now. And so if a person's been a victim of a romance scam, are there places they can turn for help?
Yeah, and two resources that we really point folks to is our Fraud Watch Network. We do incredible amounts of education and resource development, making sure that folks can spot a scam, and also what can you do if you think that you have been a potential victim of a romance scam. So I know Marnie's got that up on the screen. You can contact our Fraud Watch Network. There's a website there. But also, if you feel you've been a victim of a romance scam, the Consumer Fraud Protection Division here at the Attorney General's office in North Dakota, really great staff that are very responsive and really want to hear from folks. The more that we can get, the reporting of those scams and frauds, the more that they can shine a light on it, and hopefully then we can get more resources out there to victims. Yeah,
absolutely. I think both of those resources that are scrolling across the bottom of the screen, the AARP Fraud Watch Network, there's a team of volunteers that help folks navigate these things. They talk to folks every day. trained volunteers and resources. They really do a very nice job. And then Peril and his team at the North Dakota Attorney General's Consumer Protection Division, again, I think just do a wonderful job. So check out both resources, aarp.org/FraudWatch Network, or you can call the North Dakota Consumer Protection Division toll free 800-472-2600. So with that, we got time for, I think, one more before we probably should get out of here today. I know Marnie's getting antsy. The Mandan Braves are playing in the WDA. As I said, my favorite time of the year, sports time of the year, not just college basketball, but high school basketball tournaments going on all over the state as well. But time for one more question. Is there a resource to help those who give up their job to care for a parent?
Was interesting. I talked about this, yesterday with the Senate State and Local Governments Committee, because I think so many caregivers have to often leave their employment or leave for an extended period of time. So there are resources available. We've got a couple of them up on the screen that are going to scroll for you. The AARP caregiving site, tremendous amount of resources that you can plan for. If you anticipate that you're going to have to leave your employment to care for a loved one, and again, often it's what your family member might want. It's more cost effective, but you might have to make some decisions financially on your own that you have to leave your employment. Tremendous amount of resources on our website about caregiving and making those decisions. Also the website and the phone number that you mentioned earlier for the Aging and Disability Resource Link. There are a lot of state resources available for you as you make those decisions that could really offset, if you're losing the income from your job, that you can still stay in your home, take care of your loved one, and not have to feel guilty about taking that time away from your job. So.
Yeah, and I would not hesitate to call that number, the Aging and Disability Resource Link, the 855-462-5465. The folks over there are wonderful. They're trained. They will help you navigate all of the different resources that might be available to you, including some of those you might not have even thought of or thought to ask about. They really do a nice job at the Aging and Disability Resource Link. A number of enhancements we had pushed for in previous legislative sessions have allowed them to get staffed up and organized in a manner that they're doing a really nice job. And so they're waiting for you. If you know of someone, if you are someone who's having to give up your job, thinking about giving up your job, even if you are still working and caring for a parent or a loved one or a trusted friend or neighbor, or just somebody you care about, and you're wondering about resources to help folks stay safe and independent for as long as they can, check out the Aging and Disability Resource Link. That 855-462-5465 number is the same number that when I was referencing the rent incentives, they can also help you find other, besides the North Dakota Homestead property tax credit and renters refund program. There may be other programs and incentives or opportunities for folks to help with rent as well, and they can help you navigate that as well. So check that out. I love the mailbag episode. We have, as I said, I think it's 3 pages of questions right now that we're on. I would love to keep going, and maybe at some point in time we can come back and revisit some of those and answer a few more. As I said, I will promise you that by next week, we will have them up on the aarp.org/ND advocacy page for you to review with that. With that, we always want to leave folks with something to do, some action they can take. What action are we asking folks to do this week?
I think if you missed the Legislative Lowdown, we were excited to see how many people came out to watch it in the 4 different communities we hosted it. But it is available on our YouTube channel. You can go to the website that Marnie has up there for you. You can rewatch it. You can find out what you might have missed during the first half of the legislative session, and then we give you tips and hints on how you can get involved during the second half, because this is what's called the second period, and it's going to go pretty quickly. Yeah. So now's the time to get engaged, and the best part is to catch up by watching that Legislative Lowdown recording. So
yeah, the other thing I would just make note of is we heard you loud and clear. We got some really good feedback from you all that you also want us to do something at the end of the session to kind of do a recap of the whole session as a whole. And so stay tuned. We're making plans on trying to do something. I don't think it'll be in person like we were just earlier this week, but we will be able to do something in a little bit longer format again to help folks get that total recap when the legislature leaves here sometime in April. I think they're out of here in April.
Probably late April.
Late April. As you heard it here. We'll come back and revisit it in April. As part of that. So with that, Janelle, anything you want to add?
No, if you see me, running next week, it's just because we have to be in 3 places at one time. And I think I heard someone say that last night at the meeting, is that during the legislative session, there is an expectation that you can be in three places
at once.
Yeah. And sometimes it's possible and sometimes it isn't. So
I just want to echo it again. I think Janelle's done a nice job thus far of helping us navigate this session. We're blessed to have her up there every single day, and every once in a while she has to put up with me helping her up there as well. And I also want to give another shout out again to my entire team here at the ARP North Dakota staff offices. Marnie behind the camera today. She is saying, Josh, be quiet. I want to go watch Mandan play as part of it. But Marnie does a nice job. I know she was in Mina. Wendy, who just walked out the back door for the day to get to another meeting. She's done a nice job. I know Doreen's been on vacation, but she'll be back very soon as well. I say this all the time. I'm going to echo it again. I work with the best ARP state office in the country as part of it. And our volunteers are the best as well, because I know we had volunteer run sites, almost entirely volunteer run in Grand Forks and entirely volunteer run in West Fargo I keep wanting to say last week, but that was just Monday. It feels like a lifetime ago. So with that, again, I'm Josh Aspig, Janelle Most. We'll see you next Friday for another All Things Advocacy.